Okay, hi Albert, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. This is where we're expecting to do most of this work on the meniscus. And as is very common with these medial meniscus root tears, you've got some significant cartilage loss on this side of the knee. You can see all these areas. This is the tibial plateau down below. This is the femoral condyle up above. And you can see you've got some areas of basically full thickness loss on the femoral condyle here. And so this is another really good reason to save this meniscus. Your ACL is not torn. That usually associates more with a lateral meniscus root tear, not so much with the medial side, but we're just getting our initial look at the status of the knee, and we've got a bunch of little tricks to try to get you optimized today, starting, of course, with the meniscal repair. So I just want to give you this initial look. We'll show you some more in a little bit. Okay, so I wanted to give you a good look at what this root tear looks like. See this tear back here? See how that's completely detached? A lot of times we have to free these up to reattach them, but yours is pretty much already done that for us. And it looks like it's not that displaced, so I may not have to do much cutting of the capsule to get this repaired anatomically as best I can here. So there's a little bit of meniscal tissue here that I'm going to remove. But by and large, that meniscal tissue there looks pretty good. But I just want to show you, this is the problem. It's torn right at the root there. Okay? And we've got to get that reattached. Okay, I just want to show you the next step in what I'm doing here. I've used a curette and this curved shaver just to remove the cartilage. You can just get a glimpse of it back here because the cartilage, if we don't remove the cartilage, the meniscus won't heal back to the articular cartilage. So that's a very important step. It's one of the reasons why these injuries are surgical problems, because we can't remove the cartilage with an injection, and therefore this won't heal back to its actual insertion site. So here's the meniscus. Let me back up. There's the meniscus. You can just get a glimpse underneath here where we've been working. I can lift it up a little bit with this shaver. And you can see how we've taken a curette, a ring curette, and removed the cartilage back there. So now we're going to place a guide back there and make a hole in the tibia. Just want to show our preparation. We've got a guide pin coming through. You can see it there. You can see the edge of the meniscus right there. We're going to put a grasper on that next and see about reducing that and make sure we've got some flexibility in it. So it looks like we've got a little bit more debridement to do. We'll show you some more in a little bit. Okay, here you can see our first half hitch through the posterior horn of the meniscus. As we drop the knee, you can see how when we pull on that, that's going to reduce the meniscus nicely. We've got one more to pass. I just want to show you kind of a interval progress report. You can see it there. Okay, so now what we're going to do is take this suture passer and place our sutures into the passer, into the loop, and then take those out of the tibia. Hold the camera there, please. We'll show you that in just a sec. Okay, so now you can see that first, I'm going to flush the knee, but now you can see that first set of sutures going through the tibia. Hold the camera. As we reduce, you can see how that's going to bring the meniscus down right there. We're going to place another, I'm backing up a little bit. We're going to place another one in just a minute here. Okay, hold on. Okay, so we've got two kind of locking stitches holding down this posterior horn. We haven't tied them yet, but I just want to show you the overall picture of the knee, what it's going to look like. Let me pull back. See how that's going to secure that meniscus right there and hopefully give that a chance to heal. Obviously, we've got some chondral issues. Those areas may respond to orthobiologics, may not, but for sure we're going to protect the knee, I think, by repairing this meniscus and not removing it. So the next thing we're going to do is tie this over a button on the tibial side, so we won't be able to show that. We'll come back up on the video in just a minute. Okay, so here's the finished repair. That's way in the back, so let me pull back and give you the overall picture of the meniscus, see? And as I flex the knee, you can see how that stays very stably in position. We're going to protect your weight bearing and extension. We've already looked around the rest of the knee, but here's the ACL showing that it's intact. And then just to document the lateral compartment, you've got a little bit of a fissure in the condyle, but really or in the plateau, but no tearing over here. And in the patellofemoral cartilage, you've got some wear and tear changes here. We'll take a shaver. And this will kind of be the last thing I think that we do. Okay, so it's a little bit of a flapper in the patellofemoral joint. We're going to deal with this. We'll show you some more in just a minute. Okay, so here's the area in the trochlea that's missing some cartilage. We've smoothed it out as best we can. There's kind of a corresponding area on the patella. But again, we knew this going in. We knew that you had arthritis. That was actually a reason to preserve the meniscus as much as possible because you're so young. But I think we've done everything we can to kind of optimize your knee. So we're going to stop here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.